Onondaga County's record number of coronavirus cases set last winter at 499. It's been simply smashed each of the past 4 days. Today alone, 824. We also lost another 9 people over the holiday weekend. 3 women, 60s and in their 80s, and 6 men, all in their 50s.
And last Friday, New Year's Eve, had more than 2,000 cases. News Channel 9's Andrew Donovan asked Upstate's public health scientist what happened.
On a graph of 2021, it's easy to see how Onondaga County's daily case record set on the first day of the year was smashed on the last day.
I can't necessarily sit here on a news program and judge people for what they did or didn't do. I can say that we did our best to warn people that this was coming, and now it's here. I am not one of the people who believes that Omicron is significantly less dangerous. I think the jury is still out on that question.
The difference this year, the number of people in the hospital isn't going up as quickly as total cases. Upstate's public health scientist sees it as more proof the vaccine works.
We can look backwards and decide what we didn't do, and that's not going to help us move forward. What we can do moving forward is switch to a better mask.
Professor Chris Morley suggests trading out cloth masks, especially if they've been used since last year.
So at this point, I would urge people to use paper surgical masks that they can get pretty readily, or even look for KN95, KF94 masks, because those are going to provide a great deal more protection, both for the wearer and for the person on the other side of the wearer. I would avoid unnecessary activities at this point if you can. If you're able to work from home and your employer will let you, I would advise doing so. And we are still recommending that people be fully vaccinated, including booster shots.
After the struggle to keep everything open, some schools and businesses are being forced to close on their own. In Syracuse, Andrew Donovan, News Channel 9.